So yeah, good afternoon, everybody. Thank you very much for the invitation and for the kind introduction. So when it comes to the technology of this device, I think it's very important to understand the physics around this. But to keep you calm, I'm not an expert in physics. I try to just demonstrate and try to open a window for you as from a vascular surgeon's and endovascular specialist's perspective, and from the perspective of the clinician. So that might help you entering the knowledge behind this device. And in the second talk, Dr. Bunk also has really nice images for us to see and to understand the effect of this technology. So that is, in some regard, might be some repetitive aspect for you, but I think to understand the concept that might help. So here are my disclosures. So if it comes to myointimal hyperplasia, and that is what we are all concerned about, so we attack this and address this with drug elution these days. So we had a big controversy about drug elution and drug eluting technologies in the past years, which we all know. And it's, of course, the main treatment strategy to face the hyperplasia. So there are, moreover, some experimental attempts with radiation, endothelial seeding of bypass grafts, all well described and very interesting to read through it. And of course, we have some pharmacological effect, which we could add to our patients. But interestingly, we have also the possibility to modify fluid and fluid dynamics, for instance, with swirling flow. And I try to show you why with this way we are able to have an effect on the vessel wall, which looks like a drug eluting effect on the cells. So drug elution, of course, we all know this. It's sometimes quite, of course, interesting and tricky to understand where exactly the chemotherapeutic drug will have its effect. We know all it's a chemotherapeutic drug. We know the interferences with the microtubular formation in the cells and that it causes apoptosis, and therefore we get less intima hyperplasia. So swirling flow, the question would be, what is that? And I think it helps to visualize that. You will see that as well in the second talk. And I found this nice pictures would clearly demonstrate the physics behind it. So you might call it a rotating motion. So it's a different way of flow. Of course, in the vessel wall, you could call it a non-directional laminar flow, and it has some effect. So, but to stay easy, I think you just should know that the swirling flow is, the definition is that it's a non-directional laminar flow, so a steady state adaptation of helical flow. It can be detected and measured, which you should know. We see this in the next talk, flow visualization, and we have MRI flow analysis and pretty images. And we should know that swirling flow can be generated in experimental flow models or in vivo. And that's, I think, most important is that swirling flow modifies or alters the wall shear stress or the amount of wall shear stress in the vessel, and that directly has an effect of the vessel wall in the intima. So swirling flow is able to increase low or areas of low shear wall shear stress, while this at the same time reducing high amounts or high levels of wall shear stress, and that leads to a more favorable distribution of wall shear stress. Wall shear stress is also important to know what this means. So we have here a very nice colored image that shows us very a mixture of amounts of wall shear stress, which is typical in this helical helical flow model. So wall shear stress also can be detected and measured and can modify in vivo, can be modified in vivo by the swirling flow, what I just explained. And we have for this surgical technique, which is interesting, I think, and of course the stent technology of the biomimetics 3D stent, what we hear today. So just a short introduction: swirling flow pattern in a non-planar model of an interposition vein cuff anastomosis. I think it's interesting that we use this technique since the early 80s, where Miller proposed this cuff for dealing with diameter mismatch and a prosthetic distal below the knee anastomosis. And it came out that this kind of modification on the anastomosis leads to swirling flow and therefore better patency results. So the wall shear stress, to get back to this, why is it so important? It's well known that it has plays an important role in hemodynamic forces and the development and progression of atherosclerotic plaques. Many works have shown this. And what also is interesting to know is that there's a wide range of wall shear stress within a healthy individual or an unhealthy artery or vein. And the effect of the wall shear stress is also, like we saw in the drug elution slide, it's a very, there's these mechanical forces that transduce into biochemical signals, and therefore the cell responds to this flow, and that explains why changes in the wall shear stress via, for instance, swirling flow alters the cell signaling. And we see this, and we know this as surgeons and as vascular specialists, that the impaired wall shear stress, for example, at bifurcations, are the typical, is where we typically find atherosclerotic lesions. So I see in the carotid artery. And the reason is what you see on the right, that we have very low velocity and very low amounts of wall shear stress. So interesting is that at regions with this impaired wall shear stress in the body, you have a predilection of atherosclerotic lesions, as I already stated, and you can see that in the cellular and intercellular architecture, completely different at certain regions, and they are for predilection for atherosclerosis. And you see this as well in the intracellular gene expression, like here in fish in situ hybridization techniques. And that shows us that we have a certain gene expression profile, of course, and in cells where you have altered wall shear stress distributions, for instance, you have either an atheroprotective or atherogenic phenotype within the cell with up and down regulation of proteins. So the adaptation in the clinical setting is in this stent concept, the helical stent design, which causes swirling or induces swirling flow, as you show here in these images, compared to a straight stent design on the right side. So this was, there was a proof of concept, of course, and it was an experimental flow or intraluminal flow measured in pigs induced by the helical stent, and you see the the swirling flow stent on the right-hand side and the linear stent on the left hand. And same here, that you have various factors influenced in the helical and the straight stent design, which leads to the more favorable genotype and gene expression. So on the right-hand side, we see here that with the straight stent design, the intimal hyperplasia was much more compared to the helical stent design on the bottom. So if I conclude, swirling flow is steady state adaptation of helical or laminar flow, non-directed flow. It leads to a more favorable wall shear stress distribution, and that regulates an arterioprotective gene expression in the endothelial cell. The biomimic 3D stent system creates swirling flow, and therefore it was shown that it has a better primary patency and a reduced need for reintervention throughout year 2 in a randomized study. And the Mimics clinical program, which we hear from Professor Zeller and Michael Lichtenberg, demonstrates that it has similar outcomes compared to paclitaxel devices. Thank you very much.